Level 0. This is where venom begins. Or more accurately, doesn't. You're walking barefoot on grass, brushing past flowers. An ant crawls up your ankle. You feel something, maybe it stings, maybe it doesn't. But your body doesn't flinch. Not really. This is the zone of harmless nips and non-venomous nudges. Creatures that might pinch but don't inject anything. Spiders that bite out of fear but leave nothing behind but a faint red dot. Venom exists here in theory, not in practice. The ants on your counter? Harmless. The little house spider in the corner? Technically venomous, but it's not a weapon, more like a digestive helper for the flies it catches. At this level, venom is background noise. Biologically present, behaviorally irrelevant. You'll never know it was there. No burning, no swelling, no inflammation. Maybe a faint itch you forget in 5 minutes. Your immune system doesn't even clock in. This isn't nature attacking, it's nature brushing past you. Level 1. Venom exists, and now you feel it. But just barely. A mosquito's bite doesn't just suck blood, it injects a tiny anticoagulant. Technically, that's venom. Same for a sweat bee sting, a single fire ant bite, or even some caterpillars with irritating hairs. It's the beginning of real venom, designed to manipulate biology, not destroy it. The result? Itchiness, mild swelling, annoyance. You slap your arm, rub your neck, maybe curse under your breath. But that's it. Effects last minutes, sometimes hours. You won't remember them tomorrow. Examples: sweat bees, fire ants, single bite, non-aggressive wasps, jumping spiders. The goal here isn't to kill or even hurt badly, it's to send a message: back off. A chemical warning shot. What does it feel like? A pinprick, a burn, then a slow fade. Unless you're allergic, there's no real danger, and even then, it's your immune system overreacting, not the venom's strength. Your body handles this like a mild insult, not an emergency. Just a tiny disruption in the background rhythm of your biology. Level 2. Pain enters the picture. Still local. Still limited. But real. Venom takes itself a little more seriously. It's not just about irritation now, it's about creating discomfort. Making predators second guess. Making humans think twice before swatting. Examples: paper wasps, some jellyfish, minor stings, velvet ants, cow killers. You get stung, and suddenly you're aware of every nerve in that area. It burns. It throbs. It radiates outward. It won't kill you, not even close, but you'll remember it. Venom here is like an alarm system, not designed to ruin your body, just ruin your afternoon. It targets pain receptors, stimulates inflammation, triggers histamines. You might get redness, swelling, heat. For most, it's self-limiting. Ice, ibuprofen, wait. But if you're unlucky or allergic, it escalates. Hives, dizziness, shortness of breath. That's not the venom's design, that's your body overreacting to a basic signal. Venom is still defensive, not offensive. About territory and survival, not predation. But it's serious enough that you stop. Notice, squint, curse, run for tweezers or antihistamines. This is the level where humans start learning to avoid certain things. Level 3. Venom crosses the threshold from painful to medically significant. The burn lasts longer. The swelling spreads wider. The venom no longer just stays under the skin, it starts affecting nearby systems. You're not dying, but you're not fine either. Examples: lionfish, stonefish, minor stings, tarantula hawk wasps, large centipedes, like Scolopendra. Now we're dealing with systemic venom. Chemicals that interfere with nerve signals, blood clotting, or muscle control. The pain? Excruciating. The kind that stops you mid-step, blurs your vision, makes you gasp. You don't always need a hospital, but you do need time, rest, and maybe help carrying your gear. The venom may cause nausea, lightheadedness, weakness in the limb. It's not common, but it happens. The real threat isn't lethality, it's that the venom starts acting like it could be. Anti-venom might be recommended, not because you're dying, but because you're suffering, and the venom is too complex for your body to shrug off quickly. These creatures aren't trying to kill you, they're just exceptionally good at making you wish they didn't exist. You'll heal, but it might take days or weeks. You'll have a story, and maybe a scar. Level 4. This is the beginning of true danger. Venom that doesn't just hurt, it disrupts. It hijacks nerves, paralyzes muscles, drops blood pressure. In the wrong body, or the wrong dose, it kills. You get stung or bitten, and it's not just pain, it's systemic collapse in slow motion. Your eyelids twitch, muscles lock, heart flutters. You may lose control of limbs, struggle to breathe, vomit without warning, not from panic, but because the venom is rewriting your biology. Inside, neurotoxins block signals from brain to muscle. Hemotoxins thin the blood or cause internal bleeding. Some venoms open sodium channels, causing constant firing, your body spasms and seizes. This isn't theoretical. A bite from certain cobras can paralyze respiratory muscles within hours. A sting from a box jellyfish, minor, can cause Irritation syndrome, pain, hypertension, a feeling of impending doom. Here, the clock starts ticking. You need medical attention. You need antivenom. You need oxygen. You're not guaranteed to die, but if you ignore it, if you tough it out, your organs won't. This is where nature stops bluffing. It's not here to make a point anymore, it's here to take you down. Not out of malice, just instinct. Level 5. Venom becomes a legitimate medical emergency. A single sting or bite, and your life hangs in the balance. Examples: king cobra, deathstalker scorpion, inland taipan, world's most venomous snake, cone snail, full dose, box jellyfish, moderate exposure. At this stage, the dose makes a disaster. Venom floods your system and doesn't play fair. Symptoms: paralysis, respiratory arrest, blood pressure collapse, multi-organ failure. In the worst cases, cardiac arrest within minutes. You might start with a headache, then blurry vision, then convulsions, then blackout. And still, barely a wound in sight, just a tiny puncture. That's the scariest part. These aren't maybe effects, they're documented, studied. Cone snails are nicknamed cigarette snails because after a sting, you might have time to smoke one. The inland taipan's venom is so potent one bite could kill dozens. The king cobra bites to kill, not deter. Its venom attacks the central nervous system in massive doses. Survival depends on speed, antivenom, ventilation, intensive care, no home remedies, no wait and see. You don't walk this off, you don't even stand up. Venom is no longer background noise, it's a full body scream. And you better answer quickly, or it answers for you. Level 6. Venom stops being a threat and becomes a countdown. A single sting or bite initiates a total internal emergency. You may not know it at first. The sting might be subtle, but within minutes, your body knows, and it starts to fail in quiet, terrifying ways. Full body vomiting, violent muscle spasms, skin prickling, vision blurring. Worst of all, your breath shortens, not from panic, but because your diaphragm muscles are losing the signal to contract. This level involves powerful neurotoxins. They block the breathe signal. Leave your lungs receiving silence. Examples: blue-ringed octopus, tetrodotoxin paralysis while conscious, severe Irritation jellyfish stings, crushing pain, hypertension, sense of doom. At level 6, you need medical help immediately, oxygen, antivenom, cardiovascular support. Because the venom isn't just painful, it's strategic, disabling core systems one by one. Left untreated, the damage may become irreversible. Level 7. Venom doesn't attack the body, it dismantles it. Past pain, past paralysis, now you're in collapse. Venom affects every system. It's typically a devastating cocktail. Cytotoxins destroying living tissue, muscle, skin, organs. Hemotoxins destroying blood cells, rupturing vessels, causing internal bleeding or clotting disorders. A victim bitten may bleed from gums, nose, or into urine. Blood pressure collapses. Disseminated intravascular coagulation, DIC, can occur, bleeding and clotting catastrophically. Bruises erupt without impact. Organs fail from venom damage and circulatory collapse. Muscle cells disintegrate, clogging kidneys. This happens in hours. You'll be on IVs, oxygen, monitors. You may need blood transfusions, dialysis, surgery to remove dead tissue. Survival isn't guaranteed. The body isn't just fighting venom, it's fighting total systemic collapse. Level 8. There is no recovery window here, only delay. Venom moves faster than medicine. A single bite unleashes such a potent dose the body is virtually defenseless. This is death in real time. Consciousness goes first, you may cry out, then collapse within minutes. Respiratory failure sets in rapidly, lungs may fill with fluid. The heart spasms irregularly, ventricular fibrillation, cardiac arrest, cerebral edema, brain swelling, follows as vessels leak. Victims can go from conscious to comatose in under 10 minutes. Skin may show dark discoloration, lesions, signs of internal cellular breakdown. The body digests itself. Doctors attempt full life support, antivenom, cardiac stimulants, dialysis. But at level 8, medicine doesn't save, it prolongs the inevitable and tries to ease the passage. No triumph, only tragedy slowed by machines. Level 9. The end comes before the venom finishes its work. Not in stages, in one devastating instant. Venom is neurologically instantaneous, targeting the central nervous system directly. A dose so concentrated it bypasses everything else. Stun, blink, the world fractures. You might gasp, stumble, but no words. Within seconds, your brainstem, controlling breathing, heartbeat, shuts down. Signals stop, lungs freeze, heart rhythm dissolves, violent seizure, collapse, limp, unresponsive. Death can arrive before hitting the ground. Verified cases exist of death within 15 to 20 minutes of bites from the most extreme creatures. Microgram quantities, millionths of a gram, stop an adult nervous system cold. Autopsies reveal the horror: organs intact but liquefied, brain hemorrhaged, body clinically perfect but functionally erased. You can't treat this. You can only document it. Level 10. Theoretical. Terrifying. Unconfirmed in humans, we hope it stays that way. The absolute maximum. Hypothetical biological obliteration. Not a sting or bite, an instant erasure. Venom so concentrated, so immediately disruptive, death occurs faster than any medical response. Imagine a compound engineered to cross the blood-brain barrier instantly, unfolding DNA, collapsing circulation, stopping the heart, all before you finish blinking. Some synthetic neurotoxin research suggests this could exist. Less than a second to bind every nerve. Less than a second to stop your diaphragm, silence your brain, wipe every memory, every heartbeat. Death faster than drowning. Faster than electrocution. A perfect dose. A perfect kill. No pain. No symptoms. No second chance. If it exists, it's not documented. But nature is still experimenting. This is why we fear venom. Not just because we see it, because we know it's still evolving. And with that, we've reached the end of our venomous journey. Keep supporting and loving the content. Stay tuned for the next deep dive.